Coronavirus cases are skyrocketing in Gaza. The densely populated area has been on lockdown for more than 2 weeks, hoping to contain the spread, but that may be doing more harm than good. NBC News foreign correspondent Kelly Cobiella reports.
Across the Gaza Strip, streets are deserted, families staying home, hospitals filling up. The blockaded territory now more than 2 weeks into a lockdown. Workers like rickshaw driver Adam Zaroub is worried about his family's health and how to feed his 3 children. He says driving was his only source of income. Without it, his family has nothing to eat or drink. His mother says no one has come to help them. The children are sick and she can't take them to the hospital. 3 of Gaza's 5 hospitals have been off limits to all but COVID patients until today. Medicine and other essentials in short supply. Dr. Mohammed Asfour and his colleagues shot this video for NBC and says he and other staff are working under stressful conditions in full protective gear for hours.
You are not allowed to eat, drink, and go to a bathroom. At the same time, you have a duty to perform your tasks and optimal manner in the light of severe shortages of medical supplies, mechanical ventilators, and necessary medicines.
Cases of COVID-19 in Gaza are skyrocketing from less than 100 in early August to more than 1,500 today. The Red Cross warning Gaza's health system is woefully under-equipped to cope with a large outbreak. Just 97 intensive care unit beds with ventilators for a population of 2 million, according to Oxfam. This as tensions flared between Israel and Gaza last month. Israel firing rockets after Palestinian militants launched incendiary balloons across the border. A ceasefire now holding as both sides focus on their rising virus cases. Gaza has been under an Israeli-Egyptian blockade since the militant group Hamas took over the government in 2007, and now the lockdown. This fisherman says if nothing changes, he won't die of coronavirus, he'll die of hunger. The Zaroub family is feeling just as desperate. She says no one cares about our dire circumstances. My daughter-in-law told me one day she'll set herself afire because she can't provide basic needs for her kids.
The coronavirus pandemic has forced many schools to move to an online learning model. While it will help keep students and teachers safe, it does come with some challenges. NBC News Quibi correspondent Antonia Hilton takes us to a school district in Long Branch, New Jersey.
Today is the first day of school in Long Branch.
Put a finger down if you'd rather be in school during this time. Can you go back to Google? Oh, geez. Okay.
So just be flexible. This is all new to everyone.
Gary's struggling with the demands of remote learning.
Okay, so we're going to do forgot password. So it says, literally to click the add button.
Try
what we did, join the class.
Try it in the Zoom.
But there's no meeting ID and password, Gary.
Try it in the Zoom.
Okay. Which one's the meeting ID and which one's the password?
Try this in the meeting.
I need 2. I need a meeting ID and a password.
Okay.
So how are you feeling when you woke up this morning?
I actually woke up and started crying today. I don't want to do this again.
What would relieve some of the stress on your back right now?
School. I need the academic setting to not become a part of my home life.
What do you think the impact is going to be for him of this strange start to the school year?
I think that he's going to be socially and emotionally withdrawn. He's more into doing things alone now.
Naima is Gary's former teacher. Why does in-person instruction matter for these kids?
Because this is home to a lot of kids. This is a safe house, and that's what we call it. Like, we meet, we do all different, we wash students' clothes, we make sure students eat, we make sure we go to students' houses. So that's why it is important for our students to be here.
Dr. Salvatore hopes to get kids like Gary back into classrooms by September 21st, even if the rest of the community needs more time. So on a scale of 1 to 10, how weird was the first day?
11.
Yeah. Okay. I'm curious how you think you'll look back on this year of your career 5, 10 years from now.
I think it was very humbling. because things that we all are really good at certain things, and then we get hit pretty hard by something we can't control, and it forces us to do our job completely different. We may not know what the future holds, but I know we're resilient enough to be able to get through something really challenging.
Antonia joins us now. So first of all, what is it the district is doing to help out students who are struggling with the online learning?
Hey, Joe. So when this pandemic hit, Long Branch, New Jersey knew that a large part of their student body was going to have trouble with all of this remote learning. So Long Branch is a community full of working class families, immigrants. Many of the students reported that they didn't have consistent access to the internet at home. And so the school immediately had to mobilize. And I spoke to Superintendent Salvatore there, and he told me that they bought MiFis, hotspots, even bought Chromebooks for individual students. And the principals and teachers were driving these and directly delivering them to kids like Gary right there. So actually, while I was with Gary that day on the first day, I saw the principal of his school, Audrey W. Clark School, drive over in the middle of her workday to bring him a hotspot. Because you can see right there, he and his mother were having a hard time connecting. And Gary is a special needs student, so him getting connected with his class, feeling included, not falling behind was of extra critical importance to the district. And so they had people ready all day long on the first day to mobilize, to go out into the neighborhoods and make sure that kids like Gary could get logged on and at least on the first day get acclimated to what this strange semester was going to be like.
In addition to hot spots, hot meals are also an issue. Some students depend on those hot lunches at school. So how is the district handling that?
So Long Branch is a community where 80% of the kids in this district, they qualify for free and reduced lunch. And, that was pre-pandemic. And so they already have an infrastructure and a process in place to do food distribution around town several times a week. And they beefed all that up as the pandemic hit. Dr. Salvatore, the superintendent, actually told me that as the pandemic hit and families in Long Branch lost their jobs, he saw these lines for the food distribution stretching blocks, half a mile in some cases. And so they're going to continue that throughout school. And so some students will have food delivered to them. Some will go to distribution sites. Teachers like Naima Radi, who you saw there, are involved in efforts to also give out free food vouchers and incentives to families that engaged with things like summer learning or different activities during the school year. And so this is a way to not just provide the families the sustenance they need, but also to get an eye on them, to check in on kids, because again, this is a community with a lot of working class families, very large families, sometimes living in challenging situations right now in the midst of all of this. And so to get an eye on the kids and just talk to the parents and check in on how they're doing is a big part of making sure that not just the kids are completing their homework and their educational obligations, but that their well-being is in a decent place. And food is a great way for this district to do that.
Definitely is. And Antonia, you spoke to a teacher about how important in-person teaching is, but also they welcome the opportunity of remote learning. What did they tell you?
Yeah, so that was a consistent theme. I spoke to Naima Radi, who you saw there in the clip, but I also spoke to many of her colleagues. And what I kept hearing was, they're on the fence. They are, of course, concerned about their own health and safety. And actually, that teacher, Miss Roddy, her cousin passed away in the spring from COVID. And so she was extra fearful to step foot back into the classroom, even if the kids weren't going to be there, just her colleagues, each teaching their classes remotely in separate rooms. She started the year off with a fair amount of fear. At the same time, though, a teacher like Miss Roddy knows how much kids like Gary need her because they're much more than just social studies and English teachers. They are really doing social work in a lot of cases. So they wash clothes for many of the students. There are over 100 students in this district who are homeless. And so food, clothing, welfare checks are a big part of being a teacher and having relationships with the students. And so what I kept hearing repeatedly was, as soon as we can figure out a way for this to feel safe, we're eager to get these kids back. And so the school district told me that their plan is to try to get students who are homeless and living in motels and complicated home life situations, get them back into the classrooms first, then get special needs students back into the classroom, and then try to do their best for the rest of the student population this fall. And so they're really eager to plan all of that out. And these are ongoing conversations that the district and the teachers are having.
Seems like they're really thinking this through, too. Antonia, thank you so much. We appreciate it. And you can watch Antonia's full story on NBC's The Report. That's on Quibi this weekend. President Trump says we are turning the corner on the coronavirus, but the nation's top infectious disease doctor disagrees. Here's what Dr. Anthony Fauci told Andrea Mitchell earlier on MSNBC.
I'm hoping that we do not see a surge in cases as we've seen following the 4th of July and Memorial Day. But when you have a baseline of infections that are 40,000 per day, and you have threats of increased test positivity in certain regions of the country, such as the Dakotas and Montana and places like that, what we don't want to see is going into the fall season when people will be spending more time indoors, and that's not good for a respiratory-borne virus. You don't want to start off already with a baseline that's so high.
Dr. Amish Adalja joins us now. He's a senior scholar at the Johns Hopkins Center for Health Security. Doctor, good to see you. So first of all, just how are we doing right now when it comes to controlling the spread of coronavirus?
It's a mixed picture. If you look at places like New York, New Jersey, Connecticut, Pennsylvania, where I am, we have done a pretty good job of keeping this to a level where the percent positivity is acceptable, where our hospitals are not in trouble. But there are other parts of the country where the percent positivity is above 5%, above 10%. And we're worried about, do they have the public health infrastructure to be able to deal with new cases? And I think that's what we've seen, because we haven't really had a national plan. We've seen a very heterogeneous outbreak based upon what each governor of each state has done. And I think that's going to be a problem going into the fall.
Dr. Fauci said this week that the fall and winter will be a big test for the U.S. What are your concerns about cases spreading once the season changes?
Well, we already have around 40 to 50,000 cases occurring every day. So that's a lot of community spread going on. When you couple that with it getting colder, when it gets less sunny, when it is less humid, you're going to find people that can't be outside as much. They're going to be indoors. And we know indoor transmission does occur more frequently than outdoor transmission. We have schools opening. We have things getting back to some semblance of normalcy. And you're going to get transmission. It's just a simple biological fact. And the question will be, do we have the testing, tracing, and isolating capacity to be able to deal with that, to keep these chains of transmission from landing on vulnerable populations and putting them in the hospital and putting hospitals into under pressure in the face of a flu season, which might occur as well.
Doctor, as it gets colder, people are going to want to dine inside restaurants. New York City is going to have some indoor dining at the end of the month. We've seen some reports that express concern about that. Do you have any concerns about indoor dining?
Indoor dining is one place where we've seen transmission occur. That doesn't mean that you can never do it. It means that you have to provide people the tools to be safe when they're indoor dining, decreasing capacity, making sure people are following social distancing, face coverings. All of that makes it easier to actually dine safely. There's never going to be something that has zero risk, especially when you're indoors, but you can try and reduce the harm that the virus causes by making sure that restaurants are following the guidance and are equipped to do so.
All right, Dr. Adalja, thank you so much. We appreciate your time.
Thank you.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.